Hi, this is Dr. Koenigsberg, and it's Tuesday, January 29th, 2008. Today's psychiatry update is about why am I depressed? A lot of people have asked me about why they may feel depressed since they, quote, don't have anything to be depressed about. I think one of the important ideas is that there's a big difference between being sad and being clinically depressed. People are sad about a variety of problems. Loss of a loved one, failed exam, some from the relatively trivial to the very, very important. People are sad because something happened and triggered off a loss and they experience sadness. A clinical depression is very different. When someone has a clinical depression, they're not depressed about something. It's not an external depression about something. There's an internal, biochemical, genetic, inherited, whatever word you want to use, there is an internal depression. So they're not depressed about something, it's internally generated. Very much like when people have diabetes, they don't have diabetes about something, they have diabetes, or high blood pressure, or allergies, or asthma. External conditions trigger it, to be sure, but it's an internally generated depression. That's why in my practice, the vast majority of times, I'm treating clinically depressed patients with an antidepressant to alleviate the biochemical depression as well as psychotherapy, because quite frequently there are losses. The exact same thing is true of clinical anxiety. People can be anxious and worried about things, but when they have a clinical anxiety, they're not anxious because something has created that worry. They are anxious because there's internally generated anxiety, very much the same as if I had, 6 or 7 cups of coffee instead of 1 cup of tea. If I was fidgety and jittery, I'm not anxious about something. I have an internally generated chemical anxiety. That's why, again, the medications are very effective. So the bottom line to this 3-minute update is, yes, you can be sad about something. Yes, you may have a depression triggered by a loss and you're sad about something. But psychiatrists are trying to discern, is there a biological element, an internally generated depression and or anxiety? And that's why we have found medication treatment to be so effective in the treatment of clinical anxiety and clinical depression. I hope that helps. Feel free to email me if you have any questions or if this provokes additional thought. Thanks.